Let's come with our second segment, ladies and gentlemen, and that concerns the World AIDS Day. Today, the 1st of December, is the World AIDS Day. Why is that day important? Because since decades, this is a disease that has infected hundreds and thousands and millions of people across the globe. Millions have perished, and a lot of people are still living with it, and there are people who are taking the necessary precautions and the necessary medications to live a normal life. At the same time, there needs to be a certain understanding of what that disease is and means to the society, and what kind of precautions do we need to take. More in the following report.
World's fight against deadly viruses dates back to time immemorial, as previously unknown viruses raced around the world and emerged as silent killers. December 1st is a poignant day in global health history as we commemorate World AIDS Day and reflect upon our worldwide response to HIV or AIDS epidemic. Despite this existential health challenge only being identified in 1984, more than 35 million people have died of HIV or AIDS-related illnesses. According to World AIDS Day organization, there are an estimated 38 million people who have contracted the virus worldwide. Marking this day highlights the need to better protect the most vulnerable communities against this HIV or AIDS, including in conflict settings, small island countries, and global periphery. According to UNAIDS Report 2020, Pakistan has an estimated 183,705 people living with HIV or AIDS, and the HIV epidemic in Pakistan is heterogeneous with diverse transmission dynamics across the country. Pakistan introduced evidence-based HIV prevention and treatment program in the country in 2018 with the aim to increase the coverage of HIV prevention, treatment, care, and support services through a high-impact, focused, targeted approach. Global health community has made remarkable progress in preventing and treating HIV domestically and globally. Despite this tremendous progress, humanity's fight is not finished yet, as HIV remains a threat domestically and globally, with certain population and regions of the world bearing most of the burden and persistent inequalities serving as critical barriers to mitigate this scourge. Being cognizant of this reality, the theme of World AIDS Day 2021 is End Inequalities, End AIDS, which places special focus on regions who have been left behind. UNAIDS Executive Director, in her message, emphasized that AIDS remain a pandemic. The red light is flashing, and only by moving fast to end the inequalities that drive the pandemic can we overcome it.
Now, to talk more about the importance of how to deal with HIV/AIDS, the importance of the World AIDS Day, and the message that is for this year as far as the World AIDS Day is concerned, End Inequalities, End AIDS. We've been joined by Mr. Taoufik Bakkali. He is a Regional Director for Asia and Pacific at UNAIDS. Thank you very much, Mr. Bakkali, to have joined us, and it's an honor to have you here for this segment. Sir, does the world understand the repercussions of AIDS? Does the world understand what HIV stands for? Over the decades, we've seen countless amount of fatalities, countless amount of people who live with this disease. Does the world still understand the importance of dealing with this?
Well, 40 years since the first HIV case was found, and 40 years of experience in responding with lots of successes achieved so far. The world's still learning its way towards reaching the goal of ending AIDS. We have had a change over time in terms of our capabilities to respond to the epidemic, as there was availability of treatment, as prevention methods and models have evolved over time, and as we understood a little bit more who are the people more affected and what's the best approach effective to reach them and to help prevent the epidemic, but the infections, but at the same time also save the lives of those who are infected. But now we know what works. We know who is affected. We know how to do it. But the COVID pandemic recently has put a highlight on some aspects that were not given a lot of attention beyond the aspects of scaling up the efforts and programs and trying to reach. And there are several factors that are not specific to service delivery, but that create all the different aspects that are extremely determined to achieving a successful response to the HIV epidemic, exactly as we have learned as well with regard to the COVID pandemic. Now, the World AIDS Day team, its complete sentence is end AIDS, end inequalities, and AIDS end pandemics, because in the context of this year, with the COVID pandemic, we have learned that there is a very strong intricacy, strong linkage, and a learning that we have come that we can achieve by similar approach and similar efforts, a better preparedness to all pandemics, while at the same time reinforcing our way towards responding to the HIV epidemic.
Mr. Bakkali, when you talk of inequalities, when you talk of the pandemic, how much of this is interrelated? Because a lot of inequalities lead to social injustice, lead to a lot of intolerance, and that is what HIV also gives, a lot of intolerance and social stigmas. How does the UNAIDS, along with all the member states of the United Nations, deal with this?
All pandemics, they thrive on the fault lines of inequalities, because the people who face those inequalities are usually the ones left behind, are usually the ones who do not access protection, the ones who do not access the services. And this is why this time it's really important to give more attention that if we need to understand how to respond to HIV and speed up our efforts towards achieving the goal, as we do not have time. 2030 is very close by, and we are far away globally in achieving those goals. We understood that responding and tackling inequalities is key to achieving that. And tackling inequalities means we need to understand who is left behind. We need to understand who are more affected and why they are affected and how they are affected. But at the same time, we need to understand how can we facilitate that they access the services, that they are protected, and the inequalities that are preventing them from accessing those services are also removed. And for this, the World AIDS Day report also talks about these 5 measures that need to be taken towards removing inequalities and tackling them. And there are 5 elements here. I would like to mention them quickly. We might have an opportunity to talk for more in detail. First of all is we need community-led and people-centered infrastructure, because the communities help make linkages to the people left behind. They understand their people, they understand the reasons and how, and there is a certain level of trust. We have seen in COVID that we cannot depend totally on the health system. There is an additional component for health delivery, which is communities. The second component is equitable access to medicines, vaccines, and health technologies. The third one is human rights and laws and policies that had to build trust and tackle pandemics. The fourth one is supporting workers and at pandemic front lines and providing them with the resources and tools they need so that they can reach those more affected. And the last one is data, is the ability to understand what are those inequalities and who are affected and why, and whether those inequalities are economic, are social, are based on design of programs or of any other reasons, but at the same time, the why and how. And these are the 5 elements that are core to reducing inequalities. Now, this theme of inequalities is at the center of the new global AIDS strategy, which has been developed and adopted in the UN high-level meeting.
And there's a report that has come out that your office has also taken out that includes these 5 important elements as well.
Absolutely, absolutely. And we knew this, many aspects, because we see a number of countries who are close to epidemic control, including in our region in Asia-Pacific. When you look more in detail, the success in those efforts are also due to the consideration of those 5 measures being implemented.
All right, Mr. Bakkali, when it concerns Asia Pacific, because you're the regional director of this region, how is the success rate of your organization along with the different governments in order to tackle HIV and AIDS?
Well, it's a partnership with all facets of life, and it's not only UNAIDS. It's UNAIDS with the 11 co-sponsors, other UN agencies that go with us under the joint program and help us implement and mobilize for the response. At the same time, we have the governments, of course, but the community organizations, regional and country level, who are key in delivering all the achievements that have been seen so far. The reality is the results that are seen are not equal. There are inequalities even in terms of how much success is being seen in a number of countries. We see in Asia and the Pacific some countries who are very close to achieving epidemic control. They are very close to achieving the 95 targets. And there are countries where we have in this region as well the highest increase of new infections and the highest rates of AIDS-related deaths. Unfortunately, there are different realities that are justifying the situation in different countries, but the solution remains the same, is we need to consider all factors. It's not only considering depending on health system alone, it's not only depending on treatment alone, it's not only by not investing on the laws and the policies that are putting those people behind, or the discrimination. If it is not resolved, we cannot get there. It's really important that we need to consider all these 5 elements, because this is key for us to be able to achieve the programmatic aspects of service delivery.
All right, now the United Nations, sorry Mr. Bakkali to cut you short, 2030 is the year that has been set up by the United Nations as the year when they will try to end the further dissemination of HIV or AIDS. How much of that is achievable? Because you talk about inequalities in different countries at different levels and a lot of issues that you see and you confront in different parts of the world.
We have learned from the previous global strategy, which finished in 2020, where the global targets for 2020 have not been met in many places. But if we aggregate for regions and globally, we are not on track. That learning helped us understand why we could not get on track, on a fast track towards achieving those global targets. Now, the new strategy renews those commitments. It's not something different. It's a renewal. It's getting more ambitious. But the addition is the understanding how. Now, if the question is it achievable? I can certify it is achievable because we see countries have achieved it already. And if it is done in a couple of countries, it is absolute proof that if we do it this way, we will be able to achieve it globally and in regions and everywhere. And that's the effort ahead of us, is when we understand and know how we can achieve it, we need to follow that path. And it's clear. The report, for example, now clearly talks about the issues of why we are facing those inequalities and why, when we have the political commitment fully declared by countries, and sometimes it's followed up by investments, still the rates of service delivery are extremely low. The people who need to access those services are not accessing it. And that's because in the design of the response in a number of countries, those 5 elements are not considered altogether. And if something is missed, it's like if you are building, constructing a building, and if one pillar is missed, it does not stand. So now we understand in this report that it is achievable, provided that we follow the path that is well described in the Global AIDS Strategy, which has put inequalities at the center. There is risk that people can say, yeah, but we may the achievements could be under threat due to COVID. And we have observed that COVID had impacted over the year 2020 on slowing down the progress. But that was seen mostly in the very first few months of 2020, when everybody was trying to find a way and there were lockdowns everywhere. Very quickly, community organizations have stepped up, and we found some amazing solutions that ensured that the HIV response continued to deliver, and that people continued accessing treatments and accessing prevention methods. And there was also those mechanisms led by communities and other models that have been established in countries,
All right.
facilitated access to social
you
protection
talked about
and others.
communities and you talked about models. Now, how important is it for basic education about what HIV stands for? How can we prevent ourselves from it? And what kind of medicine or what kind of treatment do we need to take if we get HIV? How important is it for the local communities in all of the different countries of Asia Pacific also to join hands with the United Nations and the government in order to disseminate this basic understanding to the common man? Because a lot of people, sir, correct me if I'm wrong, do not have access to television, do not have access to the media, do not have access to maybe internet as well. So they need to be given that information firsthand. How important is that?
Very important, because knowledge is the basis of everything. When any person is able to understand the risks, and if anything happens, what are the options available in terms of at least knowing status, and then accessing treatment if needed, or then accessing the prevention methods, this is the basis of everything. You are absolutely right. That information needs to reach people, but this is not everything. We cannot say we let people know and the HIV epidemic will be resolved. So we need to find different ways to address different categories of the population, and this is also part of reducing the inequalities. We cannot depend on TV and say everybody will get to know, because inequalities mean that there are some people who do not have access to TV. Same thing for internet. Although internet and mobile technologies have proven to be extremely useful, particularly in the recent few years, the digital world, it has the potential to reach people who otherwise cannot be reached. And the level of and the amount of information that they can access is important. So again, it's a combination. If we want to say about sharing information, it's a combination of approaches to share information with different categories of the society. But then some people need to know more details, because by nature they are probably more at risk, either by profession or by behaviors or by some vulnerabilities. And that additional knowledge helps them prepare more to be able to prevent being infected, but at the same time also accessing the treatment and the other services, including testing.
And finally, Mr. Bakkali, let's come to Pakistan. This is the country where we are talking to you from, and you are also the regional head of different countries. That includes our country. When it comes to the response to HIV and the different measures that have been taken, how optimistic are you of the response that has come from Pakistan and the collaboration that has come from Pakistan as far as combating this pandemic, I wouldn't say pandemic, but epidemic together, that is HIV/AIDS?
I understand the situation and the epidemic of Pakistan very well, for having had the opportunity to work closely with several colleagues and stakeholders in the country. I see the tremendous political commitment. I see also the commitment to achieve and to respond to the epidemic. I see the commitment to bring in the communities and to establish partnerships. I see as well that there is financial commitment towards the response. And we have seen some data that tells us that beyond the funding that comes from external sources like the Global Fund, also there are domestic resources being done in the province, coming from the provinces and from the center towards HIV. This is really important. The challenge remains in building that infrastructure for a comprehensive response to go fast. So it's not an issue that nobody cares. That's absolutely not true. I saw that commitment by myself. It's an investment that needs to bring all stakeholders together to build that infrastructure within health. And we all know very well the challenges of capacities in the health system to deliver and to reach all people for HIV, as well as the issues of blood safety, responding to outbreaks and all these things. But at the same time, we need to build that community system to deliver HIV prevention and information and linkage services, which has started over the past years, but need to be sped up. It needs to be scaled up very rapidly so that we can achieve that goal. Even the gap are quite large in the context of Pakistan, but I think it is feasible. If we go by the right approach, and if we go with in partnership, that it is not only health, and it is not only the HIV program in health. HIV is a multi-sectorial approach, from laws and policies to education to legislators to health, of course, and every social protection. All those components come together and bring in HIV at the center would help us get there by bringing all the partners together and being able to achieve, because we understand, and in Pakistan, the analysis done, we have full understanding of who is vulnerable. So
all right.
The design of the models of interventions to reach them needs to be
the models
scaled
of
up
prevention, as you
with
said,
the right
need
speed.
to be compatible with the society that is in Pakistan.
Absolutely.
And the need to work together is needs to be more aggressive from all the different quarters that are there with the United Nations, with UNAIDS, in order to combat this epidemic that we call HIV. Thank you very much, Taoufik Bakkali, Regional Director, Asia Pacific for UNAIDS, to have joined us and to have talked to us in detail about what this day entails and this day means, and how can we end these inequalities and move together as one to combat this epidemic, so that by the year 2030, as you yourself said, you're very optimistic that we might be able to reach to an end of this disease that we call HIV. Thank you very much, sir, to have joined us.
Thank you for having me.